Today we will learn together the different environmental pollutions that define as the contamination of the physical and biological components of the Earth atmosphere system to such an extent that normal environmental processes are adversely affected. So, our topic covers about cholera, typhoid, cancer, birth defects, gastrointestinal disorders, liver disease, and kidney disease. So, let's talk about first what is cholera. Cholera is an acute diarrheal illness. So, the infection is often mild or without symptoms, but can sometimes be severe and life-threatening. People can get sick when they swallow food or water contaminated with cholera bacteria. The infection is often mild or without symptoms but can sometimes be severe and life-threatening. So, a physician checking a patient for dehydration. About 1 in 10 people with cholera will experience severe symptoms, which in the early stages include profuse watery diarrhea, sometimes described as rice water stools, vomiting, thirst, leg cramps, restlessness, or irritability. So, healthcare providers should look for signs of dehydration when examining a patient with profuse watery diarrhea. These include rapid heart rate, loss of skin elasticity, dry mucous membranes, low blood pressure. People with severe cholera can develop severe dehydration, which can lead to kidney failure if left untreated. Severe dehydration can lead to shock, coma, and death within hours. So, person washing hands over a bucket of water. Profuse diarrhea produced by... So, let's move on to typhoid. Typhoid is a bacterial infection that can lead to a high fever, diarrhea, and vomiting. The infection is often passed on. It can be fatal. It is caused by the bacteria Salmonella typhi. The infection is often passed on through contaminated food and drinking water. And it is more prevalent in places where hand washing is less frequent. It can also be passed on by carriers who do not know that they carry the bacteria. So, annually, there are around 5,700 cases, trusted source in the United States, and 75% of these start while traveling internationally. Globally, around 21.5 million people a year contract typhoid. So, if typhoid is caught early, it can be successfully treated with antibiotic. Fast facts on typhoid. So, typhoid is a common bacterial infection in countries with low incomes. Untreated, it is fatal in around 25% of cases. Symptoms include a high fever and gastrointestinal problems. Some people carry the bacteria without developing symptoms. Most cases reported in the United States are contracted overseas. The only treatment for typhoid is antibiotic. Our list is cancer. So cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. So cancer can start almost anywhere in the human body, which is made of to trillions of cells. Normally, human cells grow and multiply through a process called cell division. So, to form new cells, as the body needs them. So, when cells grow old or become damaged, they die, and new cells take their place. So, cancer is a genetic disease that is, it is caused by changes to genes that control the way our cells function. So, especially how they grow and divide. Genetic changes that cause cancer can happen because of errors that occur as cells divide, of damage to DNA caused by harmful substances in the environment, such as the chemicals in tobacco, smoke, and ultraviolet rays from the sun. So, our cancer causes and prevention section has more information. So they were inherited from our parents. So let's proceed to birth defects. Birth defects are common, costly, and critical conditions that affect 1 in every 33 babies born in the United States each year. So read more about what we have learned about birth defects and how women can improve their chances of having a baby born. Every 4.5 minutes, a baby is born with a birth defect in the United States. That means nearly 120,000 babies are affected by birth defects each year. Birth defects are structural changes present at birth that can affect almost any parts of the body. They may affect how the body looks, works, or both. And birth defects can vary from mild to severe. The well-being of each child affected with a birth defect depends mostly on which organ or body part is involved and how much it is affected. Depending on the severity, a defect can occur during any stage of pregnancy. Most birth defects occur in the first 3 months of pregnancy, when the organs of the baby are forming. This is a very important stage of development. However, some birth defects occur in later in pregnancy. Birth defects like fetal alcohol syndrome, we know the cause. But for most birth defects, we don't know what caused them. For most birth defects, we think they are caused by a complex mix of factors. These factors include our genes. So, it's a information inherited from our parents, our behavior and things in the environment, but we don't fully understand how these factors might work together to cause birth defect. For example, some things might increase the chances of having a birth defect, such as smoking, drinking alcohol, or taking certain street drugs during pregnancy, having certain medical conditions such as being obese, or having uncontrolled diabetes before and during pregnancy, taking certain medication such as isotretinoin, or a drug used to treat severe acne. Having someone in your family with a birth defect. To learn more about your risk of having a baby with a birth defect, you can talk with a clinical geneticist or a genetic counselor. Another topic we have is gastrointestinal disorder. Sometimes, tummy trouble is something serious, according to the National Institute of Diabetes and Digestive and Kidney Diseases. Somewhere between 60 million and 70 million Americans suffer from gastrointestinal problems, leading to nearly 250,000 deaths each year. These conditions are responsible for close to 50 million hospital visits and 21.7 million hospital admissions annually, according to the NDDK. What's more, treating and managing digestive diseases come with a staggering price tag of more than 141.1 or 0.8 billion of the US healthcare system. Gastrointestinal conditions are disorders of the digestive system, an extensive and complex system that breaks down food in order to absorb water and extract nutrients, minerals, and vitamins, also known as the gastrointestinal or GI tract. The digestive system comprises a range of vital digestive organs, including the mouth, esophagus, stomach, small and large bowels, rectum, and anus. GI tract also includes connected organs, the liver, gallbladder, and pancreas. Second to the last topic is liver disease. So your liver is the largest organ inside your body. It helps your body digest food, store energy, and remove poisons. Second to the last topic is liver disease. Your liver is the largest organ inside your body. It helps your body digest food, store energy, and remove poisons. There are many kinds of liver diseases. Diseases caused by viruses such as hepatitis A, hepatitis B, and hepatitis C. Diseases caused by drug, poisons, or too much alcohol. Example include fatty liver disease and cirrhosis, liver cancer, inherited diseases such as hemochromatosis and Wilson disease. Symptoms of liver disease can vary, but they often include swelling of the abdomen and legs, bruising easily, changes in the color of your stool and urine, and jaundice or yellowing of the skin and eyes. Sometimes there are no symptoms. Tests such as imaging tests and liver function tests can check for liver damage and help to diagnose liver diseases. Liver diseases doesn't always cause noticeable signs and symptoms. If signs and symptoms of liver disease do occur, it may include skin and eyes that appears yellowish or jaundice, abdominal pain and swelling, itchy skin, dark urine color, pale stool color, chronic fatigue, nausea or vomiting, loss of appetite, tendency to bruise easily. Finally, we're down to kidney disease. Chronic kidney disease, also called chronic kidney failure, involves a gradual loss of kidney function. Your kidneys filter waste and excess fluids from your blood, which are then removed in your urine. Advanced chronic kidney disease can cause dangerous levels of fluid, electrolytes, and waste to build up in your body. Kidneys are a pair of fist-sized organs located at the bottom of the rib cage. There is one kidney on each side of the spine. Kidneys are essential to having a healthy body. They are mainly responsible for filtering waste products, excess water, and other impurities out of the blood. These toxins are stored in the bladder and then removed during urination. The kidneys also regulate pH, salt, and potassium levels in the body. They produce hormones that regulate blood pressure and control the production of red blood cells. The kidneys can even activate a form of vitamin D that helps the body absorb calcium. Kidney disease affects approximately 26 million American adults. It occurs when your kidneys become damaged and can't perform their function. Damage can be caused by diabetes, high blood pressure, and various other chronic or long-term conditions. Kidney disease can lead to other health problems, including weak bones, nerve damage, and malnutrition. If the disease gets worse over time, your kidney may stop working completely. This means that dialysis will be required to perform the function of the kidneys. Dialysis is a treatment that filters and purifies the blood using a machine. It can cure kidney disease, but it can prolong your life.